In this video, we'll explain how to register a collected specimen. After you have signed in to the Sensiva Health portal, begin by clicking New Order. Begin typing any part of the patient's first name, last name, or date of birth to see a list of available patients to place an order for. If the desired patient does not populate, you will need to add them first by clicking on New Patient. Once located in the list, please select the intended individual. Then either press the Tab key on your keyboard or click outside the patient field to select the patient. The order form will then reload with the patient's information. Confirm the patient's address, insurance policy, and allergies if applicable. If the information shown is incorrect and/or missing, updated information can be added here. Once you place this order, anything changed in Step 1 will save to the patient profile. Next, select the ordering physician for the sample. Please note if your facility only has one ordering physician, they will show up by default and no further action will be needed. If there is more than one ordering physician, begin typing any part of the physician's first name, last name, or NPI number, similar to selecting a patient. In the barcode field, enter the sample ID found on the specimen tube from the testing kit used for collection. If you're using a barcode scanner, please click the icon on the right-hand side of the entry field prior to scanning. Based on the sample ID provided, you'll have the ability to select from different test types and/or different targets. You may select targets individually or select the appropriate panel. Please note that at least one non-antibiotic resistance target will need to be selected to create the order. Once a test has been selected, the individual ICD-10 codes for that test type will be available to select and/or enter. We've listed some of the common ICD-10 codes for each test type for your convenience. You may choose any combination of the pre-listed codes or enter any other ICD-10 codes in the additional ICD-10 codes field. At least one ICD-10 code will need to be entered or selected to create the order. When necessary, you will be asked to provide a medical necessity statement. If you do not add to or modify the default text, you will be asked to confirm that you're declining to add additional notes related to medical necessity for this order. Select the text that reads Click to Read to view the Patient Caregiver Acknowledgement and select the appropriate checkbox once completed. You will also see an optional box to add order notes. Verify that all information provided in boxes 1 through 5 is correct, then select Place Order. Next, select the Dashboard menu option along the top left-hand side of your screen. Then, select the Needs Approval block. Please ensure that this order is approved by the ordering physician. Select the checkbox next to the sample that needs to be approved, and then click on Approve Selected Orders. If there are multiple orders that need approved, these can be selected by clicking the word Select. You have now successfully registered the sample. Please ensure that the cap is on tight and the patient's name and date of birth are clearly labeled on the specimen tube. Once confirmed, this sample is ready to be sent to the lab for processing.